Good afternoon and welcome to this Public Health Network Cymru webinar on housing, health and wellbeing. My name is Kieran Humphreys. I'm a consultant in public health with the wider Determinants of Health unit of Public Health Wales. And I'm absolutely delighted to be here to facilitate this webinar and looking at the really important issue of housing and how it affects our health. I don't think I've ever spent as much time cooped up in a house as this last 15 months. So if I didn't know before this that it was important for my health, I'm sure by the end of this hour, I'll be in no doubt whatsoever. I'm really pleased to have here this morning three speakers to talk on this topic. So our first presentation is about the health impact assessment undertaken on housing and housing insecurity in relation to health and COVID. And this will be undertaken by Louise Woodvine and Laura Evans. Louise Woodvine is a principal public health practitioner with the World Health Organization Collaboration Centre of Public Health Wales. She specialises in health and housing and led the award-winning Charisma study on housing and asthma in children. So really pleased to have Louise here to talk about this work, and also Laura Evans, who's a public health practitioner also with the World Health Organization Collaborating Centre of Public Health Wales, and she joined the Welsh Health Impact Assessment Unit in 2019 after 5 years working in the Research and Evaluation Division here in the organisation. After that, we will have a talk on the importance of household energy efficiency in relation to health, and that will be delivered by Adam Jones, who's a policy officer also with the WHO Collaboration Centre of Public Health Wales and a lecturer in Cardiff University. He's got a very close position to our heart in Public Health Network Cymru because he used to be the coordinator for the All Wales Sexual Health Network, which was a predecessor to our current Public Health Network Cymru itself. So really delighted to have these speakers today. Before we get started, just a few points to note. There's a Q&A box that you can ask any questions in, so please do give your questions as the talks go on, and we'll pose those questions to our speakers at the end. If we don't get round to posing a question, we'll try and get them to answer afterwards and put it up on our website. The event is being recorded, and again, that will also be available on our website as soon as possible after the session. And you'll also be able to access English and Welsh subtitles. If you click on the little three dots on your screen, you should be able to access that. It's a live subtitling function, and it may not always get it right in either English and especially in Welsh. But if you do experience any difficulties with technology, just write down your problem or issue again in the Q&A box. Don't worry, it won't appear to everybody, but our technical wizards in the background will have a look and try and solve your problem for you and with you. So without any further ado, I'm going to head straight in to ask Louise to start our presentation on the health impact assessment of housing and housing insecurity. Thank you.
Sorry, Louise, you're on mute.
Okay. Is that right? Can you hear me now?
Yes, we can hear you, thank you.
Okay then, sorry about that. Good afternoon, everyone. This afternoon, Laura and I are going to talk to you about work that we've been doing with partners in relation to exploring the health and wellbeing impact on COVID on housing and housing insecurity. Following this presentation, Adam's then going to give a presentation on the importance of household energy efficiency for health. So in relation to the work for health and housing wellbeing impact on housing and housing security, and you have to bear with me because I can't actually see how to change. Casper, the slide's gone. Can you do my slides because it's disappeared?
Just give me 1 second, Louise. I may have to share your slides from my side. So presentations, excuse me, just give me 1 minute. Louise, if you could just stop sharing your slides for a second, and I'm just going to try and open it up on mine, okay?
Yeah, done that.
Thank you. Just apologies, everyone. Just opening up the slides now.
Sorry about this, it did work earlier on.
Can you see these slides here?
Yes, I can.
Okay. Can you see if I click through now to the next slide?
Yes, I can, thank you.
Okay.
Okay, lovely. Thank you very much, and apologies everyone for that. This just gives an overview of really an introduction about the health and housing reports that we've done in Public Health Wales with partners to date. And this gives an idea of the work in relation to we've done about investing in housing for health and making the case, also in relation to housing vulnerability and ACEs, the cost of poor housing and what it costs us in Wales. Also, we've done work in relation to homelessness and winter wellbeing and reducing winter pressures, and they're all very pertinent to the housing agenda. So next slide, please.
Forgive me. Hello, can you see it's moved to the next slide?
Yeah, you can see now, thank you. So to set the context for this work, this diagram gives an overview of the complexity of the home environment in relation to the wider determinants of health. You'll see there that the home is in the middle, and that's surrounded by areas of significance in relation to health, education, the importance of the home being a place of safety. And this just gives you about the complexity of the home and the support that the home gives to people in relation to different areas of our lives, and also in relation to our security going forward and into the future. Next slide, please. So my next slide is going to look at the content of the presentation. And this is what myself and Laura are going to be talking about this afternoon. First of all, what would we define as housing insecurity? Then followed by the work of the Welsh Health Impact Assessment Unit and also the health impact assessments that have been undertaken to date within the pandemic. What do we mean by health impact assessment and the HIA process? Then we're going to go on to look at the work that we've been doing, which we've called No Place Like Home, which looks at housing insecurity, and we're going to look at how we've taken that forward through the HIA process. We're going to identify the key themes that we've found in relation to this, in relation to how this affects different population groups, and also how it affects in relation to the wider determinants of health. And then finally, we're going to just briefly touch on some of the limitations of the work and our next steps. Apologies, because we won't be able to go into the detail of this work because the work has not yet been published. It's in the process of being published. So we've kept to high-level themes to share with you, and we're hoping that the work will be published in the next month or so. So next slide, please. So now I'm going to talk about what is housing insecurity. This is what we've defined as insecurity of tenure, and that's really about keeping one's home and also trying to prevent homelessness. It's also about feeling unsafe in a home, and also about the lack of ontological security. And by ontological security, we mean by there the feeling of inconsistency in relation to trying to keep a roof over your head and over households' heads, and also having that support of a home throughout life and as a secure base. So now I'm going to hand over to Laura, who's going to take you through. Next slide, please, Casper. We're going to hand over to Laura, who's going to take you through in relation to the background and context for the work and also of health impact assessment. Thank you, Laura.
Hello, Laura. I can't move your face to go on screen, so your screen won't turn red, but if you turn your microphone on, I should be able to hear you.
Yeah, I've got my microphone on. That's great. Thank you.
I can hear you. Thank you. You can carry on now. Thank you.
Thanks, Louise. So I work in the Wales Health Impact Assessment Support Unit, and I was a member of the team working on this health impact assessment. Before we move on to discuss the HIA itself, I'm just going to provide a bit of background information about WIASU, and as well as HIA methodology. So WIASU is based in the WHO Collaborating Centre on Investment for Health and Wellbeing, Policy and International Health Directorate of Public Health Wales. So WIASU provides an all-Wales service, and our usual activities include the provision of guidance, training, resources and information in relation to the practice of health impact assessment, referred to as HIA. And during the pandemic, all WIASU usual activities have been suspended as part of supporting the Public Health Wales response to the pandemic. And we don't usually routinely carry out HIAs. However, as part of the response work, several health impact assessments have been undertaken within Public Health Wales over the last year and a bit. So these have included a health impact assessment of the staying at home and social distancing policy in Wales in response to the COVID-19 pandemic, a health impact assessment looking at the public health impact of home and agile working in Wales, and a health impact assessment exploring the health and wellbeing impact of COVID-19 on housing and housing insecurity, which is the focus of this presentation. Next slide, please. So what do we mean by health impact assessment? So you'll see on the slide, and this is the European Centre for Health Policy Gothenburg Consensus definition, and this is widely accepted as the seminal definition of health impact assessment. Health impact assessment is an evidence-based, systematic and practical approach that can be used to assess the potential positive and negative, including unintended consequences of a policy, project or plan on health and well-being. In addition, it seeks to help to address health inequalities through identifying those population groups who may be particularly affected by a policy, plan or proposal. It's not a decision-making tool per se, however, it can provide insight to inform the decision-making process. HIA is used to identify ways in which opportunities for health gain can be maximised and risks to health minimised, leading to action to maximise health benefits and mitigate the health risks. And it aims to inform and influence decision-making or policy. And the wider determinants of health and wellbeing are used as the framework to consider the impacts in a systematic way. And one of the most widely referenced models depicting the determinants of health is the one included on this slide by Dahlgren and Whitehead. Next slide, please. So this slide provides the information about the HIA process. So the process is systematic yet flexible. There are 5 steps which are displayed on the screen. And although depicted as a step-by-step process, it's most useful and effective when the process is iterative with movement back and forwards through the stages. The HIA process can be applied prospectively, concurrently or retrospectively, depending on whether you want to understand a situation or want to influence decisions on policies, projects or plans. And HIA can take one of 3 forms, desktop, rapid or comprehensive, and this is dependent on the focus and the time and the resources available. Next slide, please. So as part of the screening and appraisal stages, the population groups checklist, shown on the left-hand side of the slide, is used to identify the population groups who could be more impacted than others by a policy, project or proposal. And then the health and wellbeing determinants checklist, shown on the right-hand side of the screen, is also used in the screening and appraisal stages to assist with the identification of the impacts. And both checklists, along with other tools and guides, are available on the WIAZU website. Next slide, please. So the HIA process involves the triangulation of health intelligence and data, stakeholder knowledge and evidence, and a review of the literature. And it works best when it involves people and organisations in the process who can contribute evidence, knowledge and insight. And as shown on the slide, HIA is based on several key principles and values. And these include the need for the HIA process to be transparent, ethical, equitable and participatory. And further details on HIA and the HIA process can be found in HIA A Practical Guide, which is a document available along with other key resources on the WIAZU website. Next slide, please. So now to focus on the HIA that has been undertaken, exploring housing and housing insecurity. Next slide, please. So just to look at the aims of the HIA, so the aims included to explore the health and wellbeing impact of COVID-19 on housing and housing insecurity in Wales, to provide an evidence-based appraisal of the implications of housing insecurity across the determinants of health and wellbeing, particularly in relation to social, economic and environmental influences, as well as focusing on any inequalities across the broad range of population groups in Wales, and also to identify both positive and negative impacts, as well as opportunities to enhance health and mitigate the unintended negative impacts. And the work looks to support key strategic organisations and decision makers in Wales, as well as advocating for health and wellbeing in planning and policy development in relation to housing and housing insecurity. And the work aims to support Welsh Government plans and legislation going forwards in relation to safe, stable, healthy and affordable housing and preventing homelessness. Next slide, please. So just to provide an overview of the HIA that was undertaken. So this was a comprehensive and a HIA, and it was participatory in nature. It was undertaken over a short timescale. It was undertaken between July and November of 2020. Although, as Louise said, we're in the process of preparing the reports for publication, hopefully within the next month or so. And in terms of geography, the HIA focused on Wales. So the HIA identified population groups particularly affected in relation to housing and housing insecurity throughout the pandemic so far, highlighting the uneven distribution of impacts across the population. It identified potential and actual impacts where these were observed. An internal core working group was established, and this included members of the WIAZU team, wider directorate, as well as individuals from other teams in Public Health Wales. And as I mentioned, the HIA was participatory in nature, and stakeholders were involved and included via workshops and interviews. And just to mention, the writing of the report was commissioned to the Chartered Institute of Housing. We've been working collaboratively with the Chartered Institute of Housing in drafting and finalising of the reports. Next slide, please. So just to look at the process to date. So we've completed the screening, scoping and the appraisal stages, and currently, as mentioned, the report's being finalised for publication. And following publication, an internal review and reflection will be held. Next slide, please. So just to look at the evidence that was used for the health impact assessment. So this consisted of a community health profile, and this contained health intelligence and data, peer-reviewed and grey literature. So a literature review was undertaken to identify relevant academic literature, and searches were also undertaken to identify relevant grey literature. And then qualitative data, and this included stakeholder knowledge and information obtained from 2 virtual workshops and 4 interviews. And the notes from these workshops and interviews were transcribed and analysed. This was the first time undertaking workshops virtually as part of a health impact assessment, However, the workshops were really successful and demonstrated that virtual workshops could be used effectively to gain insight and evidence from stakeholders. A case study was also used to give example of how elements of housing security, so feeling safe and secure at home and having a sense of belonging, can significantly impact on a person's health and well-being, as well as how services can provide the relevant support and advice to enable this. And all of this evidence was collated, triangulated, synthesised and analysed. And also the evidence was weighted with peer-reviewed literature and robust health intelligence evidence having stronger weight than the other types of evidence. Next slide, please. So as part of the appraisal of the evidence, the likelihood of impact, the intensity or severity of impact, and the duration of impact were assessed using the matrix displayed on this slide. And next slide, please. And I'd like to hand over to Louise now to discuss some of the key themes that have emerged from the health impact assessment. Thank you.
That's great. Thank you, Laura. In relation to the key themes, following on from what Laura has just described in relation to the health impact assessment process and gathering all this information and evidence together, what we found was there was a wide range of positive and negative impacts across the determinants of health in the short to longer term. I'm going to explain this in a little bit more detail over the next couple of slides. What we also found was there is a wide range of population groups affected. The negative impacts will have been felt most by those who were already facing challenges, and again I'll just go on to this in the next slide. The population groups that we found to be most affected in relation to housing insecurity and looking through a COVID lens were those living on a low income, private renters and tenants, people who are experiencing homelessness, children and young people, as well as home workers and women. Also, I'm just going to the next slide, look at some possible opportunities going forwards when we've looked at this information and identified what would our next steps be. And the information that we found would help to highlight the importance of strategic planning in relation to health and housing policies that aims to drive change in Wales. Next slide, please. So, bringing up some of those key themes, we found that housing-related pandemic response measures which have been implemented have a differential effect or impact on people according to their current housing circumstances. For example, for people with a safe, secure, warm and affordable home who have the ability to work from home, and the negative impacts are far less than for people who are already facing challenges such as housing and financial insecurity, overcrowding and living in an abusive environment. Also, we found that the quality, safety and affordability of a home is integral to individual experiences of the pandemic and to everyday life. Households that live in good quality, affordable accommodation, which is safe and secure in both the short and longer terms, are much more likely to have better physical and mental health and well-being. There's been some positive impacts of the pandemic in relation to housing insecurity, such as the impact of government response measures. This includes the provision, for example, the provision of temporary emergency accommodation for those experiencing homelessness. If you can recall, there's been the suspension on evictions, also the tenancy saver loan schemes, and there's also been hold on mortgage payments. And I also noticed today that there's another support scheme come out in relation to a tenancy hardship grant across Wales. There's also been negative impacts such as increased financial stress and the ability to keep one's home, and also a greater risk to women and children of domestic abuse where they live at home with an abusive parent or partner. And investing in more good quality, safe, sustainable and affordable housing requires a strategic approach across Wales and will help form part of the long-term recovery from the pandemic. Next slide, please. We also found that new house building programmes should take into account the zero carbon agenda and prioritise green investment. For example, having sustainable and affordable housing which maximises health and wellbeing outcomes. Also raising building and housing management standards, particularly in the private rented sector, to ensure that all homes are safe and secure, and this should be encouraged. And we found that the private rented sector are particularly impacted on in relation to this subject area, for example, in relation to quality of housing and affordability of housing. Also, it's about increasing collaborative working between housing support services and tenants, and building better connections with landlords will enable tenants to access the support that they need. And that support could be anything in relation to housing, financial, social and general support. The health impact assessment also identified opportunities to work in partnership with others, such as local authorities, planning departments, and particularly the third sector, to increase and improve housing security. There's also opportunities to build on the links between secure housing and increased physical and mental health and well-being. For example, having well-planned housing with good neighbourhood design and also access to green space. In relation to this work, there was some evidence and data gaps that cropped up, and in reviewing the evidence, we identified that there were groups, particularly, for example, asylum seekers and refugees, and LGBTQ+ groups were particularly lacking in relation to the evidence around that, what we could find in relation to housing security. Also, other gaps that we found were in relation to looking at housing insecurity, links with mental health conditions, those who are on a low income, and also the provision of housing and third sector support services. Also, in relation to homelessness, although there is ongoing work in relation to improving the data across Wales for homelessness, we found also that it would certainly assist this area in relation to housing security if there was more data in relation to homelessness. So next slide, please. So in looking at the key determinants of health and well-being, and looking at some of the high-level examples that we found in relation to this, these examples highlight what Laura was talking about earlier in relation to the major and the major to moderate impact of housing and housing insecurity in the context of COVID across the determinants of health and well-being. Participants in the health impact assessment highlighted a breadth of impacts on mental health and well-being from the pandemic and associated lockdowns. There's also been negative impacts on mental health and well-being in relation to increased stress, social isolation, feeling confined in the home because of lockdowns. But in relation to this area, there's also been positive impacts on mental health and well-being, such as people feeling that they're more in control of their lives and having a better work-life balance from being more at home. In relation to risk-taking behaviours, and this includes the areas of smoking and alcohol consumption, physical inactivity and poor diet. Some of the evidence we found identified a correlation between housing insecurity, COVID, and other behaviours affecting health and well-being. Also, people experiencing homelessness are much more likely to have a higher risk of physical and chronic mental health problems and engage in health-harming behaviours. In relation to social and community factors, we just pulled out a couple of examples here. And we found that the pandemic has increased violence against women and domestic abuse in some homes. And in addition to this, mothers who experience economic hardship and housing precarity are more likely to be victims of violent or controlling behaviour. In relation to sense of belonging and ontological security, secure housing plays a key role in ontological security, and about that continuity across the life course of having a home and the ability to establish being part of a community and having networks and roots. The health impact assessment identified that the loss of this sense of security can have a significant negative impact on the individual, and in some cases we found that there was a failure to support renters to stay in one place in the long term, and this really has implications for ontological security and the feeling of the long-term feeling of belonging in a community. In relation to overcrowding and housing age, we found that older houses tend to have less space and can be more overcrowded and less access to green space. And in relation to unemployment and low income, we found this has a negative impact on housing security and health and well-being, and impacts on standards of living and not being able to afford one's home. And this can ultimately lead to increased risk of homelessness if the benefits received don't cover the housing costs. And also access to support services. The health impact assessment identified positive impacts in relation to housing and housing insecurity during the pandemic, in that there was more demand for support services, whereby more agencies were working together and finding new ways to deliver services in relation to housing. Next slide, please. So, just in looking at the limitations of the health impact assessment, first of all, there was a relatively short time in which to collect the data. We collated the data from in between July and November of last year, and we've also included in the report to be published data which is past November, which we felt was felt to have a significant or major impact in relation to this work. So one of the problems was the large scope of the work. I explained at the beginning about the 3 areas in relation to housing insecurity, and this was a fairly large scope to cover and to provide that evidence and to look through all the evidence that we gathered, which was a huge amount of evidence. There's also, of course, the uncertainty of COVID going forward. It's an evolving situation. It presents uncertainties and the changing nature of the situation. For example, the government support measures that are being brought in and then being taken away. And it will be interesting to see the impact, the longer term impact that has on individuals and households. There's also about the complexity, breadth and depth of the impacts and the limitations around that, and the scale of the potential changes and those effective in relation to taking forward the HIA and other impacts that may emerge over time. So what are our next steps in relation to this? So we've identified, this is just pulling up just some of the opportunities going forwards. We felt that it would be really important to review the impact of welfare and benefit reforms on housing insecurity and also the risk of becoming homeless. And also monitoring the impact of the financial housing related support schemes which have been introduced because of the pandemic. And in relation to looking at these areas of support going forward, it would be really good to see what the long-term impact of these welfare and benefit reforms and financial housing related support schemes have had on individuals and households. Also, other opportunities identified, ways of moving forward in relation to adapting service support and delivery to increase uptake and access of services. And we found this particularly in relation to rural areas. And also the continued importance of investing in good quality, affordable and sustainable housing for all, which also includes, very importantly, access to green spaces. So we're hoping to publish the report over the next month or so, and we're hoping that this health impact assessment will hopefully go on to influence future policy and practice in Wales in relation to improving housing security and also in helping to prevent homelessness. Next slide, please. So we'd just like to acknowledge the people and the organisations that we've been working with here in relation to taking this forward. Laura touched on our partnership working earlier on, and also as well as support within from within the directorates across Public Health Wales and also our colleagues, other colleagues outside. We've had stakeholder involvement. I've just really like to name a few: the Violence Prevention Unit in Public Health Wales, National Resources Wales, Chartered Institute of Housing, Caerphilly and Ceredigion Councils, the Red Cross, LMI, National Residential Landlords Association, Citizens Advice, the Health Board, BCU Health Board, and the NEA as well, National Energy for Action. So apologies if I've missed anybody there, but to say a huge big thank you in relation to taking this work forward. So next slide, please. This just gives the contact details if anybody wants to follow up, if anybody's got any queries or questions going forward in relation to this work, or if anybody wants to discuss it, we'd welcome discussion. Okay, thank you very much. I'd like to hand over to Adam now for his presentation.
Excuse me. Trying to stop sharing my content.
Give me a shout, Casper, when it's ready.
Sorry, give me 1 second. I'm trying to stop sharing my slides now. Sorry, Adam, could you turn your camera on, please?
Yeah.
Okay, we can see other slides. Great. Okay, Adam, can you just try clicking through your slides quickly?
Yep.
Yep, that's perfect. You're ready to
Spoiler
go.
alert, now everyone knows the first slide. So good afternoon, everybody. I'm Adam Jones, and I'm Senior Policy Officer within the WHO Collaborating Centre of Public Health Wales. And I'm going to talk to you today about a piece of work I'm developing right now, nearing the end. It's an imminent publication, just like Louise's and Laura's. And this is looking at the importance of household energy efficiency for health. And here's another spoiler alert, that's the cover of the paper when it comes out. So the aim of this presentation is to inform you about the work and to provide some insights from the paper. I haven't got the time really to go into it in depth, but hopefully it'll give you an idea of the direction the paper's travelling in. And I think it's important as well, I haven't actually got an acknowledgement slide in this, but seeing Louise's has reminded me of the importance of that really. So it's important for me to acknowledge that I've had really useful discussions with colleagues in NEA, in Community Housing Cymru and Marie Curie on this piece of work. So thank you to them if they're on the call for their contributions to date. So a little overview of the paper itself. So it's going to be a short briefing paper, no more than 20 pages probably by the time it's finished. It'll highlight the key evidence, some data and academic literature and more. It will make some recommendations for future research and some key considerations for future policy options, because of course that's within my remit really, looking at the health evidence and the policy context of the topic that we're talking about, and then making recommendations and highlighting some of those gaps, a bit like Louise's work was talking about. It'll all be contextualised to Wales, but we'll consider policy approaches and evidence internationally and international policy frameworks like the UN SDGs and how they all link in. And as I say, we're aiming to publish later this summer, probably by September at the latest. And here's the next slide that I referenced in the last slide. So some of the topic head, the section headers, if you like, for the paper. So we define what we mean by energy efficiency in this context. And of course, we're talking just about household energy efficiency, so not workplaces, offices, things like that. Look at the data on how energy efficient Welsh households are currently, and I'll talk about that a bit today. Provide a summary of evidence regarding energy efficiency and inefficiency on health. Summary of the current policy and strategy context in Wales, summary of those linked international policy objectives, the viewpoints of other organisations working within this field, and then any links between COVID-19 and energy efficiency as well. So what do we know currently about energy efficiency in Wales? So in Wales, the promotion of energy efficiency is devolved to Welsh Government. Things like energy infrastructure are still a reserved power, reserved to the UK government. So the promotion of energy efficiency is the main power that's devolved to Wales in this context. And with that, the Welsh Government have introduced programmes such as Nest and RBED through its Warm Homes programme to fund energy efficiency improvements for eligible households. When we talk about energy efficiency as well, there's two sides to this coin. There's the energy efficiency of homes themselves, the buildings, but also energy efficiency of household items. And they're all commonly measured through an energy performance certificate in both contexts. And the EPC originates in European Union legislation. It's presented in a chart rating properties from A to G. A is the very efficient side, G is the not efficient. And the closer to an A rating, the lower the anticipated energy cost to the consumer. Electrical equipment is often sold with a similar schematic, but that has recently changed this year, because if you were looking for a dishwasher in recent years, you might have seen A+++ or an A++, and it was considered that this was getting quite confusing for consumers, so they've just got rid of the +++s now, and what was A++ is now A, and there's further letters down the chain. So if you're looking for a fridge now, you might see things a little different to if you were looking last year. But again, these things, the energy efficiency of appliances, all contribute to the cost of running that appliance and the impact on the wider climate. So these are factors that we consider from a wider determinants of health perspective as well. For properties, an EPC is required when selling or renting out the property. As such, any properties that haven't changed hands since 2008 may not have a current EPC. They may not have had the assessment. And once issued, an EPC is valid for 10 years. So I bought the house I'm living in 3 years ago with an EPC of, I can't remember what it was now, but that will be valid for another 7 years. And then if it's sell on in the meantime, there'll be a new one developed, etc. Listed buildings, and this is important to remember, which cannot be modified with energy efficiency measures because of their listed status. So, for example, the listing could be on the front of the property, and therefore you've still got a single glazed pane of window that was there from the 60s. I lived in a flat and had this situation. That can't be changed for triple glazing arrangement, so we can't improve that energy efficiency of that window. These because they're often exempt from the requirement for an EPC as well. So what do we know about how energy efficient Welsh households are currently? So residential buildings make up the bulk of energy emissions from buildings in Wales. 82% of all building emissions are residential buildings, and that contributes 7.5% of the total Welsh energy emissions from all things, and this is according to 2016 figures. But that figure represents a 31% reduction in total emissions from buildings between 1990 and 2016. So we can see there's been a lot of development and improvement in the efficiency of residential buildings and all buildings in that 26-year period. But still not great, there's still work to do. And social housing has the highest percentage of homes with an energy performance certificate rating of C or above. And we'll talk about that on the next slides. So on this nicely colourful chart, using our Public Health Wales colours, you'll see the light blue on the left is a B-rated property, and the green on the right is a G-rated property. So you'll see the big bulk here of properties in Wales. Sorry, on the left is a C, there are no Bs. You'll see the bulk here is C and D rated properties, mainly in the D, more than half in the D. And then if we look at that again through the lens of tenure status, so owner occupied on the left, social housing in the middle, private rent on the right, you'll see that social housing is really winning on this field. They're all C's and D's, so there's still progress to be made, but they are the bulk of the best results in Wales. And a mixed pattern for owner and private rented, but you can see a similarity between the two. So it shows that the greatest proportion of properties across tenures fall within the C and D bands, with little variance, as I mentioned. And then if we look at the distinction between urban and rural residences, you'll see a big difference here. So urban areas of over 10,000 people, more efficient, certainly more efficient than hamlets and isolated dwellings on the right-hand side. And there's going to be a multitude of reasons for this, really. We consider that the more rural the surrounding, the less likely the dwelling is to be energy efficient. 24% of dwellings in hamlets or otherwise have an F rating, the second worst for energy efficiency, with 29% having a D rating compared to 56% of the similar properties in urban settings. So what is the impact of energy inefficiency on health? I'll only give a snapshot, as I mentioned in this section, and I'm going to focus on winter health and radon and indoor air quality. So recent work published by my colleagues in the Directorate in Public Health Wales on improving winter health and wellbeing, and sources at the bottom there, looked at winter health impacts, and one of the findings was around the direct health impact of energy efficiency, and they found that the evidence was very mixed there, limited evidence in relation to advice as well on energy efficiency improvements. But this work also found that in the UK, 10% of excess winter deaths can be partly attributed to fuel poverty, with 30% of these deaths linked to living in a cold home. Other scholars out there have looked into winter health and energy efficiency improvements as well. And this paper from Osman from back in 2010 looked at elderly chronic obstructive pulmonary disease, COPD, and it's a subject of a trial in Aberdeen. 45 patients. They had energy efficiency upgrades improved, and that noted significant improvements in their respiratory output, along with lower energy costs and improved energy efficiency ratings. So again, that wider determinant stance on it. But the trial also showed that COPD patients were unlikely to take up energy efficiency improvements if they were offered it. I haven't quite understood why that is yet. I don't think the paper makes that particularly clear, but it just shows that we've got more work to do in promoting energy efficiency improvements as a thing to do to your house. Perhaps people didn't want the disruption of installation, things like that. And then radon and indoor air quality. I've put this in to show that, you know, energy efficiency improvements are not necessarily always a good thing for health. There's some impacts that we have to be aware of, negative impacts. So if you're unfamiliar with radon, after tobacco smoking, radon, which is a colourless, odourless radioactive gas, it's the second leading cause of lung cancer worldwide, meaning for non-smokers, it's the highest form of exposure in the home, exposure to lung cancer risk. And this study from 2019 from Simmons et al. Looked at comparing radon measurements in homes between 1980 and 2015, so it's nearly 500,000 UK homes as part of those measurements, and linking that with the data from information about residencies from the Home Energy Efficiency Database, which measures energy efficiency improvements. And it showed that energy efficiency measures that make homes more airtight increased radon levels, and homes with double glazing, loft insulation and wall insulation showed higher radon measurements after they were installed. So this indicates that some energy efficiency measures may have an adverse effect on indoor air quality, and it also may increase incidence of lung cancers. And again, in everything I do, I look at what the impact is not just for health, but for the wider economy and wider society. And in this context, what can we see? Well, we can see a broad policy context really that link energy efficiency improvements to a wider domestic and international policy framework. So it comes up in the UN SDGs, I think it's goal 7, if I'm not mistaken. The Wellbeing of Future Generations Act, it's within there. And of course, we've got so much on the broader climate change policy context as well. So it's not just health, it's about climate change mitigations as well. And I found a really good source here, if you're not aware of it, from the International Energy Agency website. They've got a whole database of international policy initiatives on energy efficiency and anything to do with energy, frankly. So it's a really useful resource if you're not aware of it. But what do we know about the wider economy as well? Well, we know from previous Public Health Wales work again, which I think Louise was involved in back in 2019, that we can see a strong return on investment in energy efficiency. It showed that for every £1 spent on improving warmth in vulnerable households, there's around £4 of health benefits, and every £1 spent on insulation interventions provides a return of £1.87, and that's converted from a New Zealand study, so that was in New Zealand dollars and currency translation was made. So we can see a real economic case for investing in home energy efficiency improvements. So that's a snapshot of my forthcoming paper. There's my email address, and if you like boring social media, there's a link to find me on every channel going. So and see my witterings every now and then. So thank you for listening, and I'll hand back to Kieran now, who's going to open the question session.
Great, thank you very much. Thank you to all three of our speakers for that really interesting overview of those pieces of work. We've had a few questions in, and the first few are, I think, probably Louise, aimed at the presentation that you and Laura gave. So the first question is asking, was there a negative impact on increased alcohol intake? I know you did mention the association of unhealthy behaviours in relation to people being confined to their homes, but was there any evidence on the alcohol front?
From what I recall, Kieran, it was mixed. There was both positive and negative impacts in relation to some people were consuming less alcohol and going out more regularly for physical activity and trying to lead a sort of a healthier lifestyle. But on the other hand, in relation to being isolated at home, having more time at home, there was an increase in relation to alcohol consumption. So it was very mixed according to how that person, I think there's a relationship there in relation to how a person felt, say for instance mental well-being as well. So it was mixed. There was positive and negative impacts.
Okay, thanks, Louise. And the next question is about improving data. So particularly about getting more information, for example, on LGBTQ plus experiences and possibilities of working with ONS or others to get some of that data. Any thoughts on that?
Yes, we did. We have explored in relation to LGBTQ plus groups, and also in relation to asylum seekers and refugees, and we did come across. We were trying to come across peer-reviewed papers, and we couldn't find. We found very little in order to give it that sort of significant impact. There is a range of evidence out there, but for the purposes of going through the health impact assessment, it wasn't strong enough, and so. It was one of those areas where working with groups such working with groups and organisations which support refugees and asylum seekers, and also LGBTQ plus, such as Stonewall Cymru, working organisations such as going with those, it does highlight the need for more research in those areas, and also particularly in relation to data as well, which we struggled with. Yeah.
Thanks, Louise. It sort of can be a real challenge to get that granularity, can't it, for some of the different groups like that. This next question is really recognising that there's, we know that people who are homeless often have multiple physical and mental health conditions associated with risk-taking behaviours related to alcohol, drugs, assaults. But asking, is there evidence that a control group with similar complex health issues have better outcomes if they're in more secure housing or housing first circumstances rather than in supported housing or street homeless?
That was one of the areas was identified, was a gap as well. More evidence was needed in relation to the links between housing security and homelessness, and the need for more data there. So I think that's an area that we need more looking at. I don't know if Laura's got any views in relation to that area.
Laura?
Yeah, no, nothing further to add, Louise. I agree. It's an area that it would be beneficial to do more research within. Yeah, I definitely think there's things that can be learned by looking at that more.
I mean, thanks, Laura. I think if you perhaps, take, for instance, the example of housing first and the security of that accommodation without the restrictions that are imposed on individuals that live here, and the success of that, that goes some way towards supporting, having that safe, secure, long-term accommodation impacts on a person's ability to do take less risk-taking behaviour, as an example.
Yeah. Thanks, Louise. This next question is quite interesting from a public health practice perspective, I think. It's asking, did you find any evidence on the impact of health or public health participation or involvement in housing during COVID-19, and any recommendations on how partnership with housing, or what that should be like going forward?
I think really it just highlighted the importance of partnership working with housing. It's not just about housing by itself, it's about working with housing. I think particularly in relation to health, working with housing and having that that crossover. We've done work before in relation to making the case for health and housing, and those partnerships are so important. And I mentioned about the stakeholders that we had involved in this work. Yeah, it just highlighted the importance of working with housing and in relation to health and well-being and different stakeholders.
Thanks, Louise. Like so many other areas of public health, the partnership working is really fundamental, isn't it? We've got one last question, which is for Adam. You mentioned that some energy efficiency measures were detrimental to health, for example, increase in radon measurements. Can you explain how this happened?
I can explain it, probably very crude explanation. So Louise, please jump in with your wider expertise on this. But essentially, when we make a house more, airtight, we've got insulation, triple glazed, double glazed windows. I think it comes down to there's less opportunity for the radon gases to escape the building. This is the crux of it, really. So we do these things to improve health in one respect, and improve the energy efficiency and improve the the wider climate agenda. But this is the one area of health that could be more detrimentally impacted. I hope I've explained that as simplistically as possible. It's certainly simplistic, it came from me. Louise, was there anything else to add on that? Because I know you've looked into this a bit more in depth than I have, this particular topic.
Yeah, thanks, Adam. Yeah, I think going back years ago, I can remember looking at the evidence in relation to central heating and ventilation and asthma and COPD, and it just highlighted the significance of having not just adequate ventilation but good quality ventilation in homes. So it's good to build really energy efficient housing, but it must have enough ventilation in there. And like you say, Adam, it's about really, we don't want like tightly sealed boxes that have got no airflow. They need significant ventilation, because otherwise it has been shown, some of the evidence shows that there's potential for increases in relation to respiratory ill health, such as children's asthma and COPD. And I would imagine that would be the same for radon in relation to having, an escape route for in relation to indoor air quality and that circulation there as well. So I can't stress enough about the importance in relation to ventilation, being supporting energy efficient homes for health.
Right. Thank you, Louise. And with all our efforts to make sure that we get adequate ventilation for COVID as well, I think it's a new risk we have to consider in terms of the need for adequate ventilation going forward too. We've come to the end of our time. Thank you so much, Louise, Laura and Adam, for your time and insights today. Please do join the network if you're not a member. There's a link in the side. Fill in the evaluation form. Again, a link in the sidebar. And also, if you've any suggestions for future events or future webinars, do let us know at at our email address, which I'm going to ask somebody to put into the side as well before we finish. So thanks everyone very much, and hope you have a good day. Bye all.
Thank you.